Have you ever lost your appetite, felt bloated after just a few bites, or had stubborn indigestion? Most of us blame stress, gas, or acidity. But what if your body is warning you about something far more dangerous, something silent, deadly, and often missed? It could be stomach cancer. What is stomach cancer? Stomach cancer, also known as gastric cancer, occurs when abnormal cells grow uncontrollably in the lining of your stomach. It's often called a silent killer because, in the early stages, it hides behind common symptoms like indigestion or fatigue, making it easy to ignore. Early symptoms you should never ignore. These signs might seem minor, but they could be early red flags. Feeling full too soon, even after just a few bites. Indigestion or heartburn that doesn't go away, even with antacids. Unexplained fatigue or constant low energy. Loss of appetite, skipping meals without even trying. Mild nausea without any clear reason. Weight loss, especially if you're not trying to lose weight. Reminder, if any of these symptoms last more than 2 weeks, it's time to see a doctor. Early detection can save your life. Alarming advanced symptoms. As the cancer progresses, it may cause more serious signs, such as stomach pain, especially after eating. Black, tarry stools, a sign of internal bleeding. Vomiting, which may even contain blood or look like coffee grounds. Difficulty swallowing, especially if the cancer is near the top of the stomach. Severe tiredness, caused by internal bleeding and iron deficiency. These symptoms are urgent warning signs. Do not ignore them. Who is at risk? You are at higher risk if you are over the age of 50. Have a family history of stomach cancer. Have had a long-term H. pylori infection. Smoke or drink alcohol regularly. Frequently eat salty, smoked, or preserved foods. Diagnosis and what you should do. If you have these symptoms, or fall into a high-risk group, here's what to do. Speak to your doctor about getting an endoscopy, where a small camera checks your stomach. You may also need a biopsy, blood test, or imaging scan. Don't delay. The earlier it's found, the easier it is to treat. Prevention tips. Lower your risk of stomach cancer by making healthy choices. Eat more fresh fruits and vegetables. Cut back on salty, smoked, and processed meats. Quit smoking and limit alcohol. Treat H. pylori infections early, before they cause damage. Emotional message plus strong CTA. Your stomach whispers before it screams. Don't wait for it to shout. If you or someone you love has been feeling off, don't ignore it. A simple checkup could save a life. If you found this video helpful, please like, share, and subscribe. Comment below if you want to see a video on treatment options or screening tests for stomach cancer. Together, we can raise awareness and maybe save lives. Thank you for watching. Stay healthy, stay InfoMeds.